Are you one of the 50% of women in the United States who took Tylenol during your pregnancy or is currently taking Tylenol during your pregnancy? If so, then this video is very important to your hormonal health and that of your fetus or baby. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Hot off the presses is this research study called acetaminophen paracetamol, those are two names for Tylenol, use modifies sulfation of sex hormones. And what this study gets into is looking at the possible links between Tylenol, between taking Tylenol and it ending up in male genital malformations of the newborn baby and ending up in messing with the hormone homeostasis of both the mother and the developing fetus and many other issues. So we want to dive into that today. And looking at this study, they show that taking Tylenol impacts the production of sulfated sex hormones. And some of the key sulfated sex hormones that are impacted by Tylenol are pregnenolone, are DHEA, and androstenediol. So I'll just abbreviate that here. And so Tylenol use will decrease those. Well, those are precursors that become testosterone, estrogen, and progesterone. So if we're suppressing precursors with Tylenol, you could see how that could interfere with hormone homeostasis. Well, these hormones also function as what are called neurosteroids. So in the brain, they have separate functions than just their sex hormone function. And what they do is if we suppress DHEA or pregnenolone, for example, we're suppressing neurosteroid function. And some people who take Tylenol report a calming effect of the Tylenol, or in children it's known as a sedative. Well, that could be from this suppression of these sex hormones that act as neurosteroids, so suppressing the neurosteroid effect could lead to the calming or the sedative effect. The problem with that is if we decrease neurosteroids, specifically decrease DHEA, this has led to multiple issues. And some of those issues include decreased steroid hormone delivery to the fetus or to the placenta. And you can imagine why that would be an issue in a developing fetus or developing baby, especially a male. And what they've tied that to is in males, there's a possible increased risk of genital malformation. And along with that also, they've seen in some mice studies and some human studies, decreasing DHEA and neurosteroid function of these hormones has led to neurobehavioral and neurocognitive issues. So taking Tylenol during pregnancy may be impacting the behavioral development and the cognitive development of the fetus. So this is something to be very aware of if you are pregnant and in pain and considering Tylenol for the pain relief, because there is the possibility that these issues could be driven by the Tylenol. And what the study ends up saying is that taking the Tylenol has the effect of aging 35 years on your hormones. Another way to say that is taking Tylenol is equal to adding 35 years of life to you in terms of hormonal aging. So if you're a 35-year-old female and you take Tylenol, it suppresses your hormones to the level of a 70-year-old. So if you are a fertile 35-year-old and you're looking to get pregnant, or you are a pregnant 35-year-old and you want optimal hormone homeostasis through the pregnancy and optimal hormone development and growth of the fetus, then Tylenol may not be the best choice during the pregnancy. So consider that, speak with your medical doctor and OBGYN about it. If they haven't seen this study, please put it in their hands. And know that Tylenol the other name is acetaminophen. Acetaminophen is an active ingredient in over 200 medications on the market. So just because you're avoiding Tylenol doesn't mean that you're not being exposed to acetaminophen. So read the active ingredients on the label of the medications you're taking and make sure if acetaminophen or Tylenol is something you don't want to expose yourself or your fetus to, that you speak with your prescribing doctor about alternative medications that don't include the acetaminophen.